Today I have with me Dr. Bryan Gallaer, who's a doctor of physical therapy and an absolute expert in the things that we're talking today. What really drives that passion?
I really love the blend of exercise and lifestyle change to help people do the things that they love.
What does the research say about starting with PT first?
Research shows that for orthopedic and musculoskeletal injuries, so like strains, sprains, things like that, 70-80% of those patients get better with PT alone.
What's one habit people could start doing today that would dramatically improve their long-term health?
20 minutes of exercise. Let's find your family physical therapist too.
Ooh, that's powerful. Find your family PT. I love it. Welcome to the Healthcare Revolution podcast. Today I have with me Dr. Bryan Gallaer, who's a doctor of physical therapy and an absolute expert in the things that we're talking today. He's obviously very biased because he's a physical therapist, and we're talking about the importance and utilization of physical therapy and how it's one of the most underutilized healthcare professions out there. Historically, across the nation, around 10% of the U.S. population goes to PT. And that is a huge number we want to improve because it is a huge underutilized service that we have. And just a few kind of bullet points to address here. In the United States, millions of people suffer from pain, mobility loss, and preventable surgeries every year. Yet, one of the most effective solutions is often the last thing that they try. People are lining up for surgeries, lining up for medication, and a lot of the times they're shifted back to PT, or they get the surgery and they kind of fix the problem with PT in the first place. And they save time, they save money, they save heartache, all those things. Physical therapy has the power to restore movement, prevent surgery, reduce reliance on medication, opioids. We know the opioid crisis is out of hand nowadays, and to help people return to activities they love. Yet, despite overwhelming research and real-world success, physical therapy remains dramatically underutilized in the modern healthcare system. It's very clear, and we want to change that perception. We want people to understand the value and how PT is going to help them. So why does this happen, and what are patients missing by not starting physical therapy? These are the things that we're going to dive into today. So I'll introduce Bryan. He is an absolute stud. He's a PT in our practice and a clinic director, and he's just done extremely well with patients. Just to give some background on him, he's deeply passionate about empowering patients to overcome physical limitation and reclaim their life, and specifically athletes. He grew up in a small New England town and just loved Utah, skiing in Utah, came out for trips in Utah, and eventually came out here himself. He earned his bachelor's degree in athletic training from the University of Vermont, and then his doctor of physical therapy degree at the University of Connecticut. Like we said, Bryan is passionate about helping patients and athletes of all ages and all physical limitations so they can return back to the things that they love. So Bryan, welcome to the podcast.
Thanks, Brad. It's an honor to be here. I'm really looking forward to talking about the utilization of physical therapy. Obviously, it's our chosen career path, so I'm excited to be here.
A career that we deeply love, and I was telling someone the other day, they're like, can you really find a career that you love?
Yeah.
This was someone that has been in, doing their thing for 20 years, and they're like, I don't think it's true. I don't think you can find a career you love. And I told them, I said, I found mine. Like, I literally love doing what I do. I love waking up, treating patients. I love training team members on how to treat patients better. I love having these discussions about how to improve healthcare. Like, I literally have so much passion for all of it, and I know you do as well.
Yeah, I'm right there with you. Ever since I got into the rehab medicine world with my athletic training degree during undergrad, it's just kind of been, I've been all in ever since then. It's been really fun.
Yeah, what led you to athletic training and PT in the first place?
Yeah, when I was a kid, it's funny, I was actually just talking to my mom about this a couple days ago, but she said when I was really young, all I ever kept saying when they would ask me what I wanted to do was, I don't want a desk job. I don't want a desk job. I don't want a desk job. So I was saying that a bunch.
You were just telling me you wanted a desk in your office.
I know. for 1 to 2 hours
I'll
a week.
remember that. No desk job. No desk.
Yeah. But yeah, so apparently I would say that all the time when they would ask me. And then my grandpa was actually an athletic trainer and a football coach. So he kind of was my first influence into the sports rehab world. And then I had a handful of injuries when I was young, hurt my ankle, hurt my back a couple times. So I got exposed to like physical therapy early on as well. And just became really passionate about like rehab science and the way that physical therapy can help heal and change healing timelines and things like that.
Why do you love it so much? Now that you're in it, day in and day out, you're in the thick of it, you're treating patients on a regular basis. Like, what really drives that passion?
Yeah, I mean, I really love the blend of exercise and lifestyle change to help people do the things that they love. I mean, that's what I wanted when I was a kid in PT and doing athletic training with my AT in high school. Like, I was just trying to do the things that made me really happy, and I thought that it was a fun profession to pursue to help people achieve that stuff. So
yeah, isn't it such a cool thing that we get to do every day, where it's like people come in pain or they're not able to do certain things, and we get to use tools that can help decrease their pain.
Yeah.
That's not medication, it's not cutting things, it's not causing permanent change.
Yeah.
And we get to use these tools to bring people's pain down and get back to what they love to do.
Yeah.
It's like, I want to go play volleyball.
Yeah.
Let me figure out how we can get your neck better so you can play volleyball.
Yeah.
Right?
Yeah.
And
Definitely.
it's so empowering to see. Like, I just thoroughly love it, being able to get people's pain down and get them back to things that they love with just natural ways, right? And
Yeah.
using our hands, using tools, empowering people to use movement as medicine rather than other things.
Yeah.
Yeah. So tell me, why is we just kind of shape the problem here? Why do you think PT is so underutilized in society?
Yeah, I mean, I think it's obviously very complex. I think there's two of the biggest things that stick out in my mind. Number one is the structure of our healthcare system. I think oftentimes patients historically have been funneled to physicians, MDs as the primary point of contact into the healthcare system. And physicians and MDs are awesome providers, and they have awesome tools that they use to help facilitate healing.
Yeah.
That sometimes differ from the tools that we utilize to facilitate healing. So I think that's probably one of the big ones, right? It's just the system and the structure of the system has led patients to explore those avenues first and then maybe try physical therapy later.
Yeah. And remind me, your brother is a physician?
Yeah, he's an emergency medicine physician.
Do you know what level of musculoskeletal training that they receive in school?
Yeah,
Have you talked to him about this?
a little bit. I believe it's around a couple weeks
Yeah.
of musculoskeletal training.
And that's what I understand as well.
Yeah.
They get about 3 weeks of musculoskeletal training,
Yeah.
which, to define that, musculoskeletal is anything with muscles, tendons, or joints, right?
Yeah.
And nerves as well. You know, the nerves that innervate those muscles. They get around 3 to 4 weeks of training.
Yeah.
How much did you get in your doctoral level education of musculoskeletal training?
I mean, I got 3 years for my doctoral physical therapy, 4 years during my bachelor's of science in athletic training, which all was focused around orthopedic musculoskeletal.
Hold on. So you're saying that most people with pain because of our healthcare system are going to a physician, an MD, medical doctor,
Yeah.
with 3 to 4 weeks of musculoskeletal training, and you have 3 years of in-depth musculoskeletal training plus your undergrad of prerequisites in musculoskeletal training.
Yeah.
Is that accurate?
That is accurate.
I mean, as we say that, it's like, what expert would you want to go to?
Yeah.
Right? Like, I just had a friend reach out to me about his daughter that had some hip pain, which you saw.
Yeah.
And he was going to take her to Instacare. And in my mind, I'm like, you've been to PT, you know how this works. Why would you go to Instacare?
Yeah.
Right? And ultimately, I hope people realize when you go to Instacare, there are certain reasons why you go. You go for fractures. You go for sickness, right?
Yeah,
you go for those types of things. You don't go for pain,
Yeah.
If you have pain, there's a different route, and we're going to talk all about that today. So tell me, what are the most common myths and misconceptions about PT that would maybe draw people away from it in the first place that we can really abolish today?
Yeah, I mean, I think one misconception or myth or maybe just lack of understanding is the in-depth of our training. I know that recently I think it was the most recent podcast that came out, but you guys were talking a lot about that. But I think there's just a disconnect with the general public and the understanding of the extensiveness of the training that we receive in diagnosis, systems review.
Yeah, because, I mean, if you think about the history of physical therapy, women started the physical therapy world, right? Our profession.
Yeah.
Like, hats off to these women that started our profession, that saw a need for it, and they were assistants to the doctors with almost no training.
Yeah.
But they were very compassionate, empathetic individuals. And then as we know, the evolution of our profession, eventually it became an associate's degree. And we were, again, the assistants of physicians.
Yeah.
And then as we evolved, then we became a bachelor's degree, and then a master's degree, and now a doctoral degree.
Yeah.
Right? So it's just been this huge evolution of change,
Sure.
and society hasn't really caught up to it.
Yeah.
They just think of us as kind of the assistant to the physician. It's like, well, we go to the physician first, and then the physician says we go to PT. Tell us how it works now.
Yeah, so now, I mean, Utah, we're primary care providers for musculoskeletal injury and pain, which is a recent bill that passed. And we do a thorough evaluation and assessment of a patient's condition and their general health conditions alongside of it to make sure that they're in the appropriate place to be treated. And then we utilize all the information that we gather on the initial evaluation to determine a comprehensive, individualized treatment plan for that individual, and refer to other providers when appropriate, when it's outside of our scope of practice.
Yeah, I love it. I mean, that's ultimately the expert for anything pain, anything achy.
Yeah.
Like sprains, strains, all those things should go directly to PT. If you're going anywhere else, you're going to the wrong spot.
Yeah.
And I'll take that to my grave. We are the entry point, the first provider that you should be going to for any of those types of things.
And a lot of times you're just wasting time if you go to the other options first, and that's valuable time that can really help expedite the healing process.
Why do you think people go to specialists first? It's like, I need to go to an orthopedic surgeon first because my knee hurts. What do you think, in your experience, they do that route? Because a lot of those people end up back in our office, right? They waste a lot of time.
I think because as a patient, you want to go see the most knowledgeable person that you can think of in that given field, right? So the general public will gravitate towards orthopedic surgeons or whatever specialty area they're having their problem with. So I think in their minds it makes sense to gravitate to the person who they see as having the most training, the most exposure to those conditions, without understanding that, like, that's also us as physical therapists. So I think the logic makes sense, right? The patients want to just go see the expert, the expert in whatever their injury and condition is, but not understanding that, like, that expert is probably going to send you back to these experts to work on.
Why is that an issue? If people say I'm just running and my knee starts to hurt and I'm like, man, I think I need to go see an orthopedic surgeon. Why does that become a problem for time, money, energy, all the above?
I mean, I think talking about time, right? Orthopedic surgeons' time is very valuable. They have a lot of patients that...
Are you saying that PT's time is not valuable?
No, I think everybody's time is valuable, but if we can keep the orthopedic surgeons' appointment slots filled with patients who are appropriate for their treatment and for their interventions, then we're utilizing their time more efficiently, and we're utilizing our time more efficiently by getting the patients who are appropriate to be in our office at the right time.
Could you imagine, like, you as an orthopedic surgeon and 80% of your caseload is not surgically appropriate?
Yeah. That'd be
like,
very
surgeons,
frustrating.
Yeah, right? Like, it's like I know a surgeon that is booked out for 8 months. And if 80% of his caseload is filled with the wrong patients, with patients that are not surgical, is that what he wants his time to be doing?
Definitely not.
No. Is that what his skill is in his training? No. He should be doing surgeries, right? So our job as physical therapists is to filter out that 80%, right? We should be getting the 80%. And the beauty, actually, we're going to talk about it more, the beauty of going to PT first and how it can actually prepare you. But we'll talk about that. How does the traditional healthcare pathway often steer patients towards imaging, injections, medication, just in your experience as you worked with people?
Yeah, I mean, I think kind of like we touched on before, but like the system is set up for the entry point to be physicians, MDs, and everybody who's a healthcare provider wants to help their patients in the best way that they know how to, right? So how does a primary care physician or an emergency medicine physician best know how to help their patient? It's with medical intervention, right? So that's medicine, injections, get some further imaging maybe to get some more clarity on the situation. And then obviously us as physical therapists differ from that because our tools are exercise and rehabilitation from that side of things. So I think kind of similar to like we touched on before, but that's the model that we currently utilize in our society generally gears more towards that stuff.
Yeah, and ultimately, in my mind, injections, medication, these medicinal type things that we use in the medical system, they're essentially blocking a pathway, right? You have pain, the medication, an opioid is purely to block the signal.
Yeah.
When we have pain, it's typically a check engine light,
Sure.
right? It's like there's something wrong. So imagine like you're driving your car and the check engine light comes on. It's like, I'm just going to block that signal. I saw someone put a piece of black tape over the check engine light. It's like, I'm just going to block it. If I can't see it, it's not a problem, right? But and that's so wrong, but we do it all the time. It's like, oh, let's just get an injection in it.
Yeah.
There's something wrong with it, but just inject it, right?
Yeah.
And I don't mean to like diminish the value of those things because they're actually really powerful.
So powerful, yeah.
But they're overutilized.
100%.
And the purpose of this conversation is to talk about the underutilization of PT and the power that it can have for people's lives because of the overutilization of medicinal type things like medication and injections, right? And sometimes surgery, right? A lot of these surgeries can completely be avoided if people will just go into PT. Let's dive into more misconceptions about PT. Specifically, like, it takes so much time. I'm in it for 6 months. My copay's $80 a visit. It's expensive. Let's kind of dive into some of those. What are the most meaningful to you?
Yeah, I mean, I think the in PT for 6 months one is very, I mean, for me personally, that is very rare. And
what's the longest you typically see and averages for any kind of ankle sprain or strain?
Yeah, I mean, rough average for an ankle sprain or strain would be 4 to 6 weeks. They usually bounce back pretty quickly, especially if it's
what's in just like more advanced stuff, like say chronic back pain.
Yeah, I mean, chronic
back pain. How long
pain,
are those ones?
We're getting, for my averages for those patients are 8 to 10 weeks probably. I'll have patients.
So
like
maximum you're seeing people for 10 weeks.
Yeah, pretty much, unless it's a very.
So where does that misconception come? Like, I'm in PT forever. Where does that come from? What do you think? In your experience, have you kind of seen in the community?
Just dragged out Planet Cares, I guess, from physical therapists.
Yeah.
It would be because it's not like patients are making it up, right?
Yeah. Yeah, it's coming from somewhere.
Yeah, it's coming from somewhere.
I agree.
So I think dragged out Planet Care, not enough specificity in their treatment plan to really help facilitate them back to 100% or full return to participation.
Yeah, ultimately it sounds that if people are going to PT for any longer than 2.5 months, you're not doing the right PT. You need to find a different one.
Yeah.
I think we can both agree with that. Like if they're dragging out that long, because sometimes it's this collaboration that happens. I mean, this is the healthcare revolution, right?
Yeah.
It's like, how can we get maybe medicine, injections, and PT all involved at the same time?
Yeah.
So we're slowing down that signal that's coming on, but we're also building it up through strength, through coordination, through change in mechanics.
And correcting the movement issue that led to that breakdown or led to that injury in the first place, right?
Absolutely.
Something has to cause it. So if you just shoot a steroid into it, then you're just blocking it and not changing what caused it to begin with.
Yeah, and just to play a little advocate there on the other side is sometimes just getting the injection in there to calm it down is half the battle. Sometimes 3/4 of the battle.
Yeah.
You know what I mean?
Yeah.
But when people say, oh, the steroid wore off, I mean, typically that's not the truth, right? Tell me what your thoughts are on that.
Yeah. So tons of my patients get injections to help facilitate healing, decrease pain, increase tolerance to movement and exercise. But in terms of like the injection wearing off, it's more so that we didn't correct whatever was causing the issue in the first place, right? Mm-hmm. So if you just get the injection and don't do anything to change your strength, your mobility, whatever was causing the problem to begin with, then naturally the problem just kind of comes back.
Yeah.
So
I don't know that the injection wore it off. It's more that you just didn't fix the problem.
We didn't address the underlying problem. We treated the symptoms very well with the injection, but we didn't correct anything.
Yeah, absolutely. Tell us another misconception about PT. Any other thoughts? Let's address pain and torture. PT is pain and torture. PT. Tell me about what's changed in the PT profession that can address that conversation. Because I think at one time it was pain and torture.
Yeah. I think that a lot of times patients remember the pain, right? Sometimes after surgery or when they're hurting, and we ask them to do certain movements, it can be uncomfortable. But I know...
Are you cranking on your patient's knee? Are they crying?
I pretty much never crank on my patient's knee.
It is absolutely rare.
Yeah, very rare. Unless it's a specific case, but very rarely do I do that.
Yeah.
And very rarely do I.
Because when we think about pain and torture, our profession has been known historically as ones that crank, right? Yeah. It's like we're ripping on that, right? Like, yeah. And you're crying, and we just say, no, just grunt your teeth. Here's a stick.
Yep.
Right? Bite on it for a minute. But ultimately, now we've learned that if we listen to the patient's body and we feel for when it starts to tighten up, then we back off.
Yeah.
Right?
100%.
Rather than forcing through that, because the body teaches us a lot, right?
Yeah.
And if we can kind of melt into it versus the body tensing up and pushing back against us, we end up accomplishing so much more.
100%.
Right?
Yeah.
And the patient's feedback is everything.
Yeah. I teach my patients that I would much prefer gentle frequency and consistency over short bouts of high intensity, basically. So a lot gentler but consistent versus trying to go for it all in one big crank or one big push or one big round of like hard exercise.
Yeah, I love that.
But
any other common misconceptions we need to address? Of what would hold someone back? I guess we didn't address the expensiveness.
Cost,
If you were to compare an injection cost to a PT visit, I don't even know if you know this.
I'm not that familiar with injection costs. I obviously am very familiar with PT cost.
Yeah. I mean, ultimately, a PT cost, why don't you address that? I'll address the injections. Sometimes injections can be covered under your plan.
Yeah.
A lot of times you're paying self-pay around $400 for an injection. Say you need it for your knee or your low back. Depending on where it is, you're looking around $400. How much is a PT session if you're just do self-pay?
Self-pay, $110.
Yeah, around $100, right? Yeah. So you think about, like, you get 4 hours with a doctor of physical therapy coaching you and giving you tools to change your pain for good.
Yeah.
Or you go to a physician for 15 minutes.
Get stuck.
With a needle. Is PT really that expensive when we're doing apples to apples?
I mean, I don't think so.
Yeah, I mean, it's not. It's very, very different, right? How much is an MRI?
I mean, those can be upwards of $1,000 depending on...
$400 to $800 depending on, like, just to get a picture of what's going on, $800. You can spend 8 hours with a doctoral level PT, right? So I hope that really kind of gives people insight on the value of PT. There's so much time that you spend. You go to see an orthopedic surgeon, guaranteed less than 10 minutes.
Yeah.
Right? There's some of those orthopedic surgeons are seeing 60 patients a day. Right? Most of the time, you're not even seeing the orthopedic surgeon. You're seeing one of the assistants, one of the 12.
Yeah.
Right? And I shouldn't joke about that. Maybe 3 with the top surgeons. 1 to 3.
Yeah.
And again, they want to be doing surgeries. They're not going to be dealing with these other issues. But I hope that really highlights the the value of PT, because it's really, in healthcare, it's the least expensive thing out there. Yeah. And this year, we actually passed a law in Utah for copays to match primary care copay. So instead of paying roughly $50-$60 a copay for every PT visit,
like 10 or 15 now.
Yeah. And it's going to take some time for these insurance companies to catch up, maybe a year and a half, 2 years, but we made that happen in Utah. And legislators are seeing that PT is really making a difference in prevention. And that's why they're so supportive. Most of the time, insurance companies win. This is one of the first times.
Not this time.
They were so surprised. They were so caught off guard. They weren't even prepared.
Yeah.
Because they're like, we always dominate these, so we didn't need, we literally dominated that.
Yeah.
And they were way impressed by our arguments about the things that we brought up, the research that we brought in, and just kind of how we got legislators on board with us. It was pretty incredible to see. Tell us, what does the research say about starting with PT first?
Yeah, so starting with PT first, research shows that for orthopedic and musculoskeletal injuries, so like strains, sprains, things like that, 70-80% of those patients get better with PT alone. So one-stop shopping, done. Their patients recover back to their prior level before injury, and they're doing a lot better.
My gosh, 80%, that's a pretty dang good statistic for most injuries, right? Tell us about the injuries. Give us just like a kind of maybe 5 to 10 injuries that you're like, you should definitely be going to see a PT for these types of things.
Yeah, I mean, we talked about ankle sprains, definitely ankle sprains, knee pain with running, shoulder pain with overhead lifting, low back pain, like all these things that people struggle with in our society that we can do so much for them in physical
How would
therapy.
you explain to the public about what the majority of, just say, back pain is? Is it that I had a bad back because I inherited it from my grandma? Like, what are the things that actually cause, I know that's very general, but like speaking in general terms, what actually causes most low back pain?
Yeah, most low back pain boils down to stiffness, tightness, imbalances in muscles, basically, improper strengthening form, stuff like that. Nothing in terms of like you got your bad back from your grandma or from your dad or different stuff like that is very uncommon for stuff like that to be truly causing people's pain. It boils down to their exercise habits and different things like that.
Yeah, I love that you said imbalances, right?
Yeah.
That really speaks true to me because I just got a flat tire this morning. It's really dramatic and I had to buy all 4 new tires. Long story short, that aside, it reminds me of tires, right? When your tire is not aligned, you could have a brand new tire and it's not balanced and it's going to get uneven wear. And as we age, because of the demands of our life, all of a sudden we develop imbalances in our body.
Yeah.
Right? And areas become too tight. Areas become maybe too weak, and other areas too strong. It's like, I like to do a lot of bench pressing, but I don't like to do a lot of pulling.
Yeah.
Right?
100%.
And all of a sudden, this ball and socket in my shoulder is very imbalanced, like a car tire going down the road.
Yeah.
Does that mean I have a bad shoulder? No. Like, I didn't inherit this shoulder from my grandma, right? Yeah. This is my life circumstances that have changed. And it's not a bad shoulder. It's purely the demands of my life have made it very imbalanced.
Yeah.
and having a check-in point with a PT to say, what's going on with this?
Yeah.
Most likely it's biomechanical, and you just need to correct some of those imbalances.
Yeah.
And bada boom, bada bing, your shoulder's better,
Yeah.
right?
And that's why following through with the whole physical therapy plan is so important too, because we can get you out of pain, but then we have to correct months, years of imbalance, basically, to get that shoulder or knee or whatever body part you're struggling with to back to functioning the way that it is supposed to, that isn't going to cause you pain.
Yeah, absolutely. So let's move to the power of movement-based healthcare. Can you envision for a minute that you go to a healthcare provider and they prescribe you exercise as your first appointment, right? That's like just the standard. Instead of medication, opioids, it's like we're gonna assign you and prescribe you a nice dose of exercise.
Yeah, I think
right?
That sounds awesome. I mean,
it sounds really cool for us, right?
Yeah.
Imagine that healthcare system.
Yeah.
And how we are changing that, right?
Yeah.
That is the new model, right? There's things that you're missing. And a lot of people are like, well, I exercise and I hurt. Well, no, it's the right dose of exercise.
Or the right, like, specific exercise that you need to be doing.
Yeah, and we've talked about this on the podcast a lot. Like, if I got my glasses and I handed them to you, are they going to work?
They sure aren't.
No, it's the specificity. They're very specific exercises that you need, and it may be 3 levels lower, right?
Yeah.
But specific exercises to meet your needs. So how does physical therapy help the body heal and recover? Just in that general question, where are we at there?
Yeah, I mean, I think physical therapy helps the body heal and recover by addressing stiffness, weakness, imbalance, like we talked about. It can help promote blood flow to an injured area or damaged.
Why do you need blood flow to an injured area?
Yeah, because blood flow is how we repair and heal ourselves. The blood flow brings our healing cells, our repairing cells into that area to help promote healing.
So what happens when someone just goes and rests versus they keep moving with an injury? As far as blood flow goes.
Yeah, as far as blood flow goes, blood flow drastically reduces to the injured area. And it's a concept that I teach to all my patients in terms of like absolute rest versus relative rest, right? Absolute rest is what you're talking about, where we're just resting. Bed rest, we're not moving, we're trying to...
Or immobilization, right?
Yeah.
In the back, 10 years ago, we still see this today. People get an ankle sprain, it's like, throw a boot on it for 6 weeks, and it's like, there's nothing worse you can do.
Yeah.
Like, literally, I want to throw that boot across the parking lot, right?
Yeah.
Like, you should not be in a boot with an ankle sprain. You should get moving that very particular movement.
Yeah, maybe a lace-up ankle brace so they can still walk.
So still a bit of, some protection there.
Yeah.
But not immobilization.
Yeah. And that's kind of the idea of relative rest, is finding where the patient's at in terms of their injury, what they can tolerate, and making sure that they stay moving to promote blood flow, promote healing in that area without aggravating it more. That's
genius. I love that. And so we kind of talked about why movement is such a powerful tool in treating pain. Why, say for instance, someone develops a tendonitis. Why do we exercise a tendonitis?
Yeah, because that tissue, the tendon itself, it needs load to repair and to...
What do you mean by load?
Exercise. Like, it needs to be worked out in a very specific way to help build it up stronger.
So if I have a tendonitis and I just sleep it off, or I just absolute rest,
whenever you go back to whatever it was you were doing before that was bothering you, it's likely to hurt you again.
But you're saying it's because I didn't do specific exercises that are going to make it to go away.
Exactly, yeah. Specific exercise is going to help actually strengthen that tendon and make it stronger, so you can go back to playing volleyball or being a baseball pitcher, or picking up heavy things out of the cupboard when you're cooking for your family or things like that.
Yeah. So how does PT actually address the root cause
of
an injury in general? Like, when we look at PT, we talk about this all the time in our practice, right?
Yeah.
How do we actually get to the root, right? Because there's symptoms, right?
Yeah.
It's like what is the symptom of this, but what's actually the root cause? How is PT actually addressing that rather than blocking a signal, things like that?
Yeah, I mean, it comes back to doing a thorough evaluation, getting a good understanding for everything that is going on with our patients, and then effectively managing symptoms, but while also correcting the imbalances or whatever led those symptoms to occur in the first place. So I don't know if that answered your question.
That does answer my question. Let's give some advice to our listeners here. How does someone know to go see a physical therapist? What are reasons to go see a PT? We already talked about certain level injuries.
Yeah.
But it's like, how do I know if this is just an ache and pain I slept on my pillow wrong, or this is something I actually need to go in for? Give us some advice here.
I think that any ache and pain that you're feeling that's persistent or repetitive for like a week or two, I would recommend just go see your physical therapist.
That's genius.
Because
why do you say that week or two? What happens after week 2?
Yeah, after week 2 and much longer, it becomes much more challenging to correct the true underlying cause, because now we're dealing with more widespread symptoms as that pain kind of expands a little bit. Mm-hmm. And the negatives of coming to see PT early on, I can't really think of any aside from
getting you better faster.
Yeah. But the negatives of waiting it out become drastic. I mean, now we're dealing with chronic pain, potentially other compensations that we develop as a result of our initial injury.
Mm-hmm. You start you start walking weird, and all of a sudden then you got hip pain and back pain too, and then we're just unraveling this, right? I fixed garage doors as a young teenager. Anyway, I was, 6 years old till I was 21, and we'd go out and fix these garage doors. We charged $75 for a service call, but I'd go out as a little 15-year-old, 16-year-old and fix these doors, and sometimes the cables on the sides would fall off because it would come down on like a garbage can or maybe a person or something. They hit something, so it would throw it off, and the one cable would come off. But then you'd have Super Dad come over here and FYI, or come fix it yourself.
Yeah.
Right? And he would make it 10 times worse. Right?
Yeah. Then
the cable was like tightened and cinched down, and it would take me so much longer to fix the garage door. If you would have just left it alone, I could have had it done in 5 minutes.
Yeah.
But because you didn't leave it alone, now I'm going to be here for an hour and a half.
Mm-hmm.
Right? And I share that story because sometimes patients do that, right?
Yeah.
Sometimes they wait months and months, and we have to unravel all of these
years sometimes.
Yeah, I mean, you see it, right? Like people have had this for 20 years.
Yeah.
And they had foot pain, and now they have ankle pain, and now they have knee pain and back pain, right? And it's like, if we would have just addressed the foot pain 20 years ago,
you wouldn't after week 1,
so it ends up saving you time, right? And all
money,
that suffering,
energy, I mean, quality of life.
Yeah. So right? I love you say 1 to 2 weeks. If it's not getting better, see a PT.
Yeah.
Because we'll help you get it drastically down. I didn't tell many people this. I don't know if I told you, but 2 weeks ago, I was squatting super heavy, getting close to my max, the freaking next day. And I love treating low back pain. I rarely have any back pain. I rarely have pain in general. I mean, I broke my 34 bones early on in life, and we just wrapped up pain at that level, right? But, I had an intense amount of low back pain 2 weeks ago. I was barely walking. I was like, oh my gosh, here we go, right? And it was just a good reminder. I'm like, man, I got myself better in like 6 days.
Yeah.
Like from intense low back pain, not being able to stand up, barely being able to walk, my wife was just laughing at me. Like I couldn't even go skiing. It was intense. It was that bad. But 6 days, right? I'm not saying we can do that for the public.
Yeah.
There's this level of knowledge that I have, that I can feel my own body. I know the biomechanics. I know what I can do, what I can't do. Then I'm just able to get it back so much quicker.
Yeah.
Right? But that's essentially what we can do, right?
Yeah, same thing goes for our patients. I mean, when we get patients in very early on in their injury or pain, it is exponentially easier to get them better. Now, obviously, there's cases that don't necessarily respond that way, but the overwhelming majority of patients, the faster you get in, the faster your pain goes away.
Absolutely. So as we wrap up this conversation, what's one thing that every person should understand about their body and movement and just along these topics? What's one thing that you hope they take away from this conversation?
Yeah, I like the check engine light metaphor. I think patients really should understand that, like, their body's talking to them when they're in pain. So they should listen to those check engine lights that pop up and do something about it. Go see the appropriate provider
Before you get 12 of them.
Exactly.
Yeah.
Before the whole dashboard starts lighting up and you got to pull over on the side of the road and call AAA. You want to make sure that you listen to that first light and take care of it the right way, and you won't have many.
I love that.
residual
Don't
issues.
put black tape over the check engine light.
Definitely don't do that.
Don't just block it. Pay attention to it. Do something about it.
Yeah.
So, a similar question. What's one habit people could start doing today that would dramatically improve their long-term health? What would you say?
One habit that they can do to improve their long-term health would be 20 minutes of exercise. Like, in the simplest form, I think that is the number one thing that we need in our society is just more movement. So that can look like walking your dog for 20 minutes or riding the bike for 20 minutes.
Yeah, I love that you're talking about intentional exercise, right? It's not like, oh, I'm active for my job. It's like, no, go out and do intentional 20 to 30 minutes of exercise.
On top of your normal day to day.
Yeah.
I think that would make the biggest difference for the vast majority of our population.
I don't know the statistics off of my head for the United States, but there's a very low level of human beings that actually exercise for 30 minutes a day.
Yeah.
It's so ridiculously low. I want to say it's less than 10%. So if we were to change society, I love what you say, like just start with something small.
Pick something
20
easy.
minutes,
yeah.
Right? Yeah, go walk your dog, get out, because I think a lot of us are self-deceived. We're like, oh, yeah, we exercise a lot,
yeah,
and then you map it out, and you're like, I only got out twice this week for 30 minutes,
yeah,
right? But the accumulation throughout your life of things that can develop with lack of exercise is really, kind of wild.
How often do you watch TV at night? Do balance training for 20 minutes while you're standing there watching TV.
Absolutely. We're doing this challenge right now. It's literally kicking my butt. We are 66 days in now to a 75 hard challenge, which part of it is you do 45-minute workout outside, one 45-minute workout, and then a second 45-minute workout. So
that's a lot.
It's an hour and a half of working out a day, and it's very surprising all the things you can eliminate in your life. It's like, I figured out, like, we can eliminate that. Like, if we're going to do this challenge 45 minutes twice, and sometimes, unfortunately, it's sleep that you give up with that. But, it's super fun. It's powerful, and it's so good. And so good for relationships. I get out with my wife and walk at night, and we just catch up, right? It's such a powerful thing.
Yeah.
And so good for your health as well. Anything else that you hope as we close that you hope healthcare changes or society understands about PT really serving their lives?
Yeah, I think the number one thing would just be utilize PT more. Like we talked about a lot.
Just do it.
Do it. I mean, come, go find a physical therapist near you for any of your aches, pains, injuries. They're going to be the expert that you need to help you get back to doing all the things you want to do.
Right, and I would add this piece as well. Find your provider. Find your family PT.
Yeah.
The PT that you trust, that you go to, you send all your kids to, you send your parents to, you send your husband to. Like, find that PT that serves you and stick with them. Because
I agree.
They'll understand your life. They'll understand the things that you want to do, and they'll remember you if you find the right one. And it really makes a meaningful difference.
Yeah. And I think people do that already, right, with their childhood primary care physician. Let's find your family physical therapist too.
Ooh, that's powerful. Find your family PT. I love it. Well, thank you so much for joining us on the podcast, Bryan. Appreciate what you do for the community and the impact that you're making.
Thanks for having me, Brad.